Donald Trump's latest medical report might look like just another footnote in the news cycle, but behind the numbers is a stunning contradiction. The very medical advancements helping him stay alive are the same ones his policies are defunding, dismantling, or denying to millions of Americans. This video isn't about Donald Trump's weight. It isn't even about his cholesterol. It's about a much larger, more alarming reality. While the former president benefits from the most cutting-edge, government-funded medical science in the world, he's simultaneously undercutting that same system for the rest of the country. We're going to unpack what Trump's medical records really say, not just about him, but about the health of our national infrastructure, the accessibility of life-saving care, and the policies that threaten it. We'll explore the medications he's likely using, the science that developed them, and the very real consequences of defunding the institutions that made those advancements possible. In March 2024, Donald Trump's annual physical revealed some key details. Weight loss: Trump had lost around 20 pounds since his last check-in. This shifted him from the obese to the overweight category based on his BMI, cardiac risk. In 2018, a coronary CT scan showed plaque buildup in his arteries, an early sign of cardiovascular disease. Cholesterol treatment, his LDL cholesterol, often referred to as the bad cholesterol, had dropped significantly from 143 milligrams per deciliter to 51 milligrams per deciliter. Drug regimen: though not confirmed in public statements, his prescription drug list shows usage of rosuvastatin and ezetimibe, a combination known in medical practice as intensive lipid-lowering therapy, typically prescribed for high-risk cardiac patients. These results, analyzed by Dr. David Kessler, former FDA commissioner and senior health advisor to multiple presidents, suggest a well-managed, medically guided improvement in Trump's cardiovascular health. But here's the catch: the science and infrastructure that developed these drugs, treatments, and diagnostics, Trump has been working steadily to dismantle them. Let's break it down. 1. Statins and ezetimibe. Statins, like rosuvastatin, also known as Crestor, are among the most prescribed drugs globally for lowering LDL cholesterol. Ezetimibe works by reducing the absorption of cholesterol in the small intestine. These medications dramatically lower heart attack risk. Studies show that intensive lipid-lowering therapy can reduce the risk of major cardiovascular events by 25 to 40% over 5 years in high-risk individuals. But here's the important part. These therapies were made possible through decades of taxpayer-funded research. The National Institutes of Health, or NIH, funded the early-stage research that identified LDL receptors, critical to the development of statins. This work won a Nobel Prize in 1985 for scientists Michael Brown and Joseph Goldstein. The FDA, the federal agency Trump has repeatedly criticized and attempted to shrink, shepherded these drugs through the rigorous trials that brought them to market. Though not confirmed, many suspect Trump may also be using a GLP-1 receptor agonist like Ozempic or Wegovy, which are primarily used for type 2 diabetes and weight loss. His rapid weight loss and physical transformation mirror the effects commonly seen in users of these drugs. These medications, too, owe their existence to public research. Scientists at Massachusetts General Hospital, with federal grants, helped uncover how GLP-1 signaling controls appetite and insulin production. NIH-funded studies laid the groundwork for their widespread use in the treatment of obesity, a major public health crisis affecting over 42% of American adults. While Trump's health may be improving thanks to government-supported science, his policies are actively unraveling the institutions that made those advancements possible. During his presidency and beyond, Trump repeatedly proposed slashing the NIH budget, with cuts ranging from $4.7 billion in 2017 to a near $2 billion cut in 2020, including direct hits to grants used for disease research, drug development, and pandemic response. Imagine a researcher working on the next generation of obesity drugs at a public university. Their NIH grant gets revoked. The lab shuts down. A decade from now, the next Trump may not have a new life-saving treatment available because the research was never finished. Under Trump, the FDA suffered from political interference, staff attrition, and budget freezes. In recent months, reports have surfaced of over 6,700 recusal notices, a sign of professionals leaving or being restricted from their roles, often due to political pressure. Government credit cards for essential FDA operations were frozen, meaning basic operational functions like site inspections and supply management have slowed or stopped altogether. Staff losses cripple critical review panels that approve drugs, monitor safety, and respond to crises like pandemics or contamination. Perhaps the most direct consequence for ordinary Americans, Trump has proposed or supported hundreds of billions of dollars in cuts to Medicaid, which covers more than 76 million low-income Americans. He rescinded a Biden-era proposal that would have added Medicare coverage for weight loss drugs like Ozempic, making them accessible to millions of seniors with obesity and diabetes. These aren't abstract numbers, they're life and death consequences. There is a bitter irony at play. Donald Trump is surviving, perhaps thriving, on drugs developed by scientists he ignores, paid for by agencies he defunds, and regulated by experts he purges. He receives elite treatment at Walter Reed, has access to experimental monoclonal antibodies, and is monitored by teams of federal doctors with the best equipment and training available. The average American, they're left to navigate denied insurance claims, drug prices that have more than tripled since 2010, a shrinking public safety net, and shortages of key medications due to budget-driven bottlenecks in approval and supply. Trump's medical records should not just spark gossip, they should ignite outrage. They serve as a living example of America's growing health divide. Those with wealth and power benefit from the very systems they're dismantling, while ordinary citizens are left to struggle, suffer, and die waiting for the same help. If Trump can use science to extend his life, shouldn't the rest of us at least have access to the same science? It's not personal, it's policy, and it's killing us. Thanks for watching.